Noradrenergic transmitter synthesis. Inside the presynaptic adrenergic nerve terminal, tyrosine is taken up, which is converted by the enzyme tyrosine hydroxylase into DOPA. This is the rate limiting step. DOPA is further decarboxylated into dopamine, which is taken up by the vesicular monoamine transporter into the vesicles, where it is further hydroxylated into norepinephrine. This norepinephrine, upon stimulation, is released into the synaptic cleft, where it interacts with its receptors on the postsynaptic membrane. It is taken up back into the nerve terminal by norepinephrine transporter. Tyrosine inhibits tyrosine hydroxylase and prevents the synthesis of norepinephrine. Rezapine blocks the vesicular monoamine transporter and depletes the stores. Guanethidine inhibits the release of norepinephrine into the synaptic cleft. Cocaine and tricyclic antidepressants are reuptake inhibitors.